Good morning and welcome to the Pennsylvania Coalition of Nurse Practitioners Annual Lobby Day, a day designated by our organization to encourage nurse practitioners to gather at the Capitol and lobby for patients' access to quality health care across the Commonwealth. My name is Amanda Laskuski and I am the president of the Pennsylvania Coalition of Nurse Practitioners. I'm a family nurse practitioner practicing in a pediatric primary care setting, serving a largely underserved area in Reading, Pennsylvania. I'm joined today by Senator Spartalotta, Senator Collette, Representative Gens, Representative Warner, Representative Tarek Khan, a nurse practitioner themselves, Janice Miller, President-elect of the Pennsylvania Coalition of Nurse Practitioners, a small sampling of nurse practitioners who serve the patients of the Commonwealth, several patients of nurse practitioners, and one of our collaborating physicians. Pennsylvania is in the throes of a healthcare provider shortage, and this is forecasted to only get worse. By 2030, 30% of our primary care providers will be retiring. This leaves patients struggling to find replacement providers they trust to provide the care they so desperately need. We know Pennsylvania's fastest population is older adults, estimated to make up 24% of Pennsylvania's population by 2040. This is across the Commonwealth in rural, urban, and suburban areas. Although there are many primary care offices in these areas, these providers are not sufficient to meet the needs of patients in these areas. Likewise, the shortage is felt in rural areas where the providers are far spread, and as one retires, there are not enough to fill the gap. Between 2010 and 2020, the number of rural Pennsylvania primary care physicians decreased by 40%, while nurse practitioners increased by 178. Pennsylvania is in the throes of a mental health care crisis. We're suffering from a shortage of mental health providers, increasing needs of mental health treatment and substance abuse disorders, and increasing maternal death rates. The U.S. recently hit a 58-year high in its maternal mortality rate, double the rate of the UK, Canada, and France, making it one of the most dangerous high-income countries in the world to deliver a baby. Maternal deaths due to pregnancy-related causes were 32.9 deaths per 100,000, with mortality rates 20.6 times higher in women of color than women of white, and 30% of maternal deaths were among women of color. In 2020, Pennsylvania saw 111 maternal deaths. In Philadelphia alone, an average of 18 women die each year during or within 1 year following their pregnancy. 9% of counties in Pennsylvania are maternity health care deserts, without a hospital or a birthing center offering obstetric care, and without obstetric providers. This has only increased in the last year. More than 105,000 Pennsylvania women between the ages of 18 and 44 years of age live in these areas. Over half of all maternal deaths occurring in the year following births are caused by mental health issues and/or substance use disorders, including suicide and accidental drug overdoses. Nearly half of Pennsylvania counties have no psychiatrists, hindering care for postpartum depression and other mental health disorders and addiction. Compared to the average state in the country, Pennsylvania has double the medically underserved areas, 30% more primary care health professional shortage areas, and 62% more medically underserved populations. The issue at hand is that current healthcare provider shortages hindering patient access is exacerbated by a restrictive regulation on nurse practitioners. These regulations, particularly the collaborative agreement, limit nurse practitioners' ability to practice independently, despite their proven capabilities and training. There will be many suggested solutions, but nurse practitioners are ready and able to serve the patients of Pennsylvania. They need not be recruited. They reside and practice right here throughout the Commonwealth. But their practice is restricted by an archaic rule that each nurse practitioner have an agreement with a physician to practice. This agreement, called a collaborative agreement, is required for the nurse practitioner to prescribe and treat patients. This agreement might lead one to believe that these physicians are actively involved in patient care. Reality is quite different. In most cases, the nurse practitioner has never met the collaborating physician, and the physician has never met these patients. It is simply a financial agreement with which the physician is paid a yearly fee for a signature on a piece of paper filed with the state board. Nurse practitioners are not physicians, nor do we want to be. Nurse practitioners are expertly trained providers who have completed training in a population focus such as pediatrics, neonatology, adult gerontology, family practice, women's health, and mental health. These nurse practitioners have completed at least 7,000 hours of clinical training, starting with basic nurse training through the nurse practitioner training and passed certification exams. To maintain certification, nurse practitioners must complete 100 continuing education hours and 25 pharmacology hours or sit for their certification exam again. Additional education requirements were in place for state licensure. Additionally, nurse practitioners are required to maintain liability insurance to maintain the designation of certified registered nurse practitioner. Senate Bill 25 and House Bill 739 would lift the requirement of an agreement between the nurse practitioner and a physician without diminishing collaboration. It's in our DNA. No more would a primary care physician need a contract to collaborate with a cardiologist than a nurse practitioner needs a contract to collaborate with a physician or any other healthcare provider. 27 states, the District of Columbia, and the Veterans Administration have eliminated the need for collaborative agreements and allowed nurse practitioners full practice authority. Not one state nor the VA has reversed this decision. Pennsylvania is an island surrounded by full practice states, including Maryland, West Virginia, Delaware, and New York. We are losing precious healthcare capital, nurse practitioners who live in the Commonwealth but practice in the surrounding areas. What more proof is needed of the safe, quality care nurse practitioners provide? Empowering nurse practitioners not only addresses the healthcare gap, but promotes economic efficiency. It reduces bureaucratic barriers, leading to cost savings for both healthcare providers and patients. Additionally, it encourages entrepreneurial opportunities for nurse practitioners, contributing to local economics rather than losing these forward-thinking practitioners to the surrounding states of Maryland, Delaware, and New York. This approach is cost-free, and it's a common-sense solution. Currently in Pennsylvania, nurse practitioners are limited in practice due to the inability to find collaborating physicians. Without these physicians, nurse practitioners cannot provide care to patients in need, and the patients of Pennsylvania are suffering due to lack of care. Restrictions on nurse practitioners were temporarily lifted during the COVID-19 pandemic, and nurse practitioners proved that we can successfully provide high-quality care for patients without these restrictive agreements. Nurse practitioners across the Commonwealth were hailed as heroes for working on the front line, expanding access when it was needed most, and ultimately saving patients' lives. These bills do not change the care provided or practice of the nurse practitioner, but allow greater access of care for patients. And by passing Senate Bill 25 and House Bill 739, nurse practitioners can continue to be healthcare heroes to everyday Pennsylvanians who need access to quality healthcare care. Let's get this legislation passed. For patients' sake. I now would like to welcome a patient and a nurse practitioner, Faith Sassman, up to speak.
Good morning. Morning. Ladies and gentlemen, esteemed colleagues, and distinguished guests, I thank you for the opportunity to speak today. I stand before you and advocate for a critical shift in how we approach healthcare delivery in this country, specifically in the need of granting full practice authority to nurse practitioners in the state of Pennsylvania. Nurse practitioners are among the most highly trained healthcare professionals in the field today. They are registered nurses with advanced education and clinical training, often holding a master's or doctoral degrees, and they are licensed to diagnose, treat, and prescribe medication to patients. Not only am I part of 4 generations to be cared for by a nurse practitioner, but I too am a nurse practitioner myself. I spent 6 years as a registered nurse working in the neonatal intensive care unit and emergency medicine, gaining valuable knowledge and skills that I used to complete 3 years of education in order to obtain my master's in nursing and become a licensed nurse practitioner. Despite this extensive training in many states across the country, nurse practitioners are still restricted by outdated laws that limit their ability to provide full care to their patients. These limitations not only hinder the NP's ability to practice to the full extent of their training, but also create unnecessary barriers to high-quality, timely care for our patients. At its core, the question is simple. Why should a highly trained healthcare professional be prevented from providing the care that they are fully capable of delivering? Let me be clear, nurse practitioners do not want to replace doctors, but they are an absolute vital partner in the healthcare ecosystem. Research consistently shows that nurse practitioners provide a high level of patient-centered care, with outcomes that are comparable, and in some cases, even better than those provided by physicians. NPs are trained to approach healthcare with a holistic perspective, emphasizing prevention, education, and ongoing care. This approach has been shown to reduce hospital admissions, improve chronic disease management, and lead to greater patient satisfaction. The evidence is clear. States that grant full practice authority to nurse practitioners see better access to care, particularly in underserved areas. By removing restriction, supervision, or collaborative agreements, NPs can efficiently meet the needs of their patients, especially in rural or low-income areas, where physicians are in short supply. But let's not forget the most important part, patient care. Patients deserve access to high-quality, timely, and affordable care. Nurse practitioners provide all of that. They are passionate about patient advocacy, and their ability to work autonomously gives them the freedom to be strong, trusting relations have trusting relationships with their patients. Relationships that lead to improved healthcare outcomes. Let me tell you a brief story about a 70-year-old farmer who presented with circummoral numbness without any other symptoms. He was quickly referred to the local emergency department to be diagnosed with a myocardial infarction or a heart attack, requiring quadruple bypass surgery. Not only did his nurse practitioner quickly recognize this uncharacteristic sign, but she stayed with him in the hospital to monitor and advocate for his care during his recovery. I tell you this because my grandfather, who then went on to live until age 87, shows the high level of care and compassion that nurse practitioners provide to their patients. Full practice authority will empower NPs to take on more responsibilities, reduce wait times, and allow them to respond to patient needs faster and more effectively. Furthermore, research shows that giving nurse practitioners full practice authority reduces healthcare costs. NPs are adept at managing patient care efficiently, focusing on prevention and chronic disease management, both of which significantly lower the long-term costs of care. As we face an aging population, rising healthcare costs, and increasing demands for services, we can no longer afford to limit the practice of qualified and highly trained nurse practitioners. It's time we acknowledge their ability to provide high-quality care and grant them the authority to do so fully. Let's give nurse practitioners the autonomy they need to do what they do best. That's serve patients, improve outcomes, and transform healthcare for the better. Thank you.
It is now my pleasure to introduce our prime sponsor in the House, Representative Nancy Genst.
That's it. Good morning, nurse practitioners.
Good morning.
Give yourselves a hand of applause, please. Good morning. I stand before you today to continue the push for full practice authority for nurse practitioners in the state of Pennsylvania. Full practice authority will increase access to quality health care for all Pennsylvanians. No matter where you are located, rural, suburban, urban areas, quality health care should be readily available at all times. Full practice authority has been established in 27 states, the District of Columbia, and the entire VA health system. Pennsylvania allowed for it during COVID, and there have been 30 pilot programs that have been conducted and proven effective. So there is no need to run a restrictive, long-term pilot to prove what has already been shown successful. Pennsylvania's fastest growing population is older adults, which is expected to grow to 24% of Pennsylvania's total population by 2040. I'll be one of those people in there. This rapid growth will increasingly require greater demand for health care, with the number of primary care physicians declining in the state of Pennsylvania and the number of NPs rapidly growing. Full practice authority is a no-brainer to provide all Pennsylvania residents with quality and accessible health care. 82% of patients support full practice authority. True. Without full practice authority, nurse practitioners and healthcare systems will continue to pay burdensome fees to doctors who will only collaborate if they have a costly contract. How terrible is that? Our residents deserve high-quality health care. Studies from the last 20 years show that nurse practitioners have consistently provided this compared to physicians. And don't get me wrong, I love physicians. My sister-in-law is a physician, but there's no way she would sign on to this. True. It's a no-cost, common-sense solution. For patients' sake, it's time to allow full practice authority for nurse practitioners.
It is now my pleasure to introduce our prime sponsor in the Senate, Senator Camera Bartolotta.
Thanks. Thank you so much, Amanda. Welcome to Groundhog Day! Yeah! You guys don't give up. Thank you. Thank you. Thank you for not giving up on this.
Thank you.
Oh my gosh, please give them a huge round of applause again. These people are amazing. They provide excellent, outstanding care for our most vulnerable populations. I've got all these notes on here, but you know what? I literally think of this bill in my sleep all the time. We have been pushing this wet rope uphill since 2013. Enough already. Enough. We absolutely need to do this. You know what's really encouraging is that every single time we have one of these rallies, our crowd grows. I love it. This grows and grows all the time. But you know what shrinks? The number of our highly educated, highly trained, highly experienced, and compassionate nurse practitioners leave Pennsylvania. That number reduces every single year. As Amanda said, we sit in a donut. Pennsylvania is a donut because all around us are all these other states that allow these brilliant, hardworking, dedicated medical professionals to do what they do best. We are losing this battle, folks. The demand is increasing astronomically. You've heard all the stats and all these other things. And Amanda, I would love to take your speech and put it on my website. Oh my God, everything you were saying was incredible. The numbers. And I know it's just all a blur, and you've seen this before, but this is what we have to do to provide really, really good health care. Affordable health care in our pockets of population that can't travel. These could be urban centers where they've got elderly folks, disabled folks, people with psychological issues who don't want to leave their home. Hello, can we provide health care for these people, or are we just going to forget them? And how about our urban areas? I represent the southwestern corner of Pennsylvania. I literally am in the arms of West Virginia. Greene County, Washington County, a tiny little bit of Beaver County. You can't get there from here a lot of times. The travel alone that some of these folks need to do, it literally is preventing them from getting the care they desperately need. So their conditions, what? They get a whole lot worse, whole lot worse. So I could read you all these statistics, all these numbers and everything else, but you know what I really want to do? I want to tell you a few things that are super relevant right now. I have been told by some folks, I won't name who, well, you know what? If they want to be a doctor, why don't they just go to medical school and be a doctor? They don't want to be doctors. That's as crazy as saying, okay, there's a whole lot of cancer cases happening in Pennsylvania. You know what we should do? We should make every single doctor go back to medical school and become an oncologist. Why don't we do that? Why don't we do that? Of course we don't do that. That's absurd. That is absurd. And again, as was said by the representative, we've had countless pilot programs. Pilot programs are 27 now, other states that have been doing this brilliantly and effectively and safely with great outcomes. The District of Columbia, and I don't know, every VA in America. If we can trust our beloved heroes to nurse practitioners and what they do best, I think we can release the chains from our nurse practitioner army of what used to be 18,000. That number's a lot less now, a lot fewer. So I think what we should be able to do is do what's best for our constituents, do what's best for our vulnerable populations, do what's best for our children who need psychological care, mental health care, because they were locked down for 2 years in COVID. Again, another pilot program, COVID, right? They were allowed to do what they do the very, very best, and they saved lives because they went to people who were terrified to go to their physician's office or their hospital. They reached out and they helped people get well. We need to do this. We need to do it this year. We need to get it again overwhelmingly through the Senate, not once, not twice, I believe 3 times. Let's get this done and quit pretending that we care about the health of Pennsylvanians. Let's actually do something and prove it. Let's put our money where our mouth is. And by the way, this is free. It's not going to cost the taxpayer anything. Do what makes sense. Let's protect vulnerable populations. Let's get these wonderful nurse practitioners out there doing what they do before they leave Pennsylvania. We can do it this year. Please write calls, smoke signals, whatever you need. Get to your representatives, get to your senators and say, this is the year we absolutely have to do it. SB 25 in 2025. It's time.
It is now my honor to introduce Senator Maria Collette.
Thank you. Well, good morning, everyone. And as Senator Bartolotta said, happy Groundhog Day. I'm Senator Maria Collette. I represent parts of Montgomery County in our state Senate, and I am also proud to be a nurse. Go nurses! I am thrilled to join this coalition of fellow nurses, advocates, lawmakers, and friends fighting for better, more accessible health care for every Pennsylvanian. And like you, I'm a firm believer in allowing our medical experts to practice to the fullest extent of their education and training. It's why I've signed on to Senate Bill 25 as a co-sponsor each time it's been introduced by my colleagues, Senator Bartolotta and Boscola. If the last 5 years have taught us anything, it's that we need all of the qualified and skilled medical help we can get to serve people in their time of need across all 67 counties here in Pennsylvania. In the midst of an ongoing healthcare staffing crisis, these updates to our nursing law are desperately needed to improve the availability and quality of healthcare in every corner of our Commonwealth. With SB 25, we can remove obstacles for our highly competent nurse practitioners, letting their skills shine while ensuring patients get the care and attention that they deserve. We can join 27 other states in the District of Columbia who have already embraced full practice authority, and we can reduce the strain on our hospitals and primary care providers without compromising safety. And we can do this for the entire Commonwealth. Many legislators on both sides of the aisle recognize that this is the way forward, but not everyone is on board yet. That's why today we're sending a clear message that our dedicated nurse practitioners need more than just lip service from representatives here in Harrisburg, more than our thanks and our social media posts. They need action. So let's keep up the pressure. Let's remind our colleagues that full practice authority is not just about nurses. It's about the people they serve every single day, our families, our friends, and our loved ones. Let's get this done. Thanks, everyone.
I would now like to invite Dave Hogan, a patient of one of our nurse practitioners, to come up and speak.
I'm not a nurse, but I do use a nurse practitioner. Good morning, everyone. My name is David Hogan. I live here in Harrisburg, and I'm speaking to you today as a private citizen to gain your support for full practice rights for nurse practitioners. I hope we can make the kind of care that I'm receiving available to more Pennsylvanians. As a patient, I suffer from a wide range of medical conditions, physical injuries, illnesses, and some mental health concerns. I chose a nurse practitioner because I wanted a patient-centered approach. I see great value in the kind of nurturing attitude that nurse practitioners bring to the table. As a career HR professional, I am aware of the differences in the education of doctors and nurses, but I also see the difference in the personal attributes of the people who choose these professions. As a citizen and as a veteran, I also see this as an issue of not just medical choice, but freedom of choice. And I guard that freedom jealously. Under the care of my nurse practitioner, I feel more like a full partner in my own medical care, and I started to see enhanced outcomes. Several years ago, my nurse practitioner told me that she had to close her clinic. You can't imagine my disappointment. I asked why, and she explained the costly mandates that nurse practitioners face in Pennsylvania. I had no idea that my nurse was paying a doctor under the terms of a collaborative agreement. All I knew was that my nurse practitioner was the best care I had ever received, and now I was losing her. But I was fortunate. My nurse practitioner found a new practice, and I'm still able to see her. Now, just in the past few days, I found that the physician who is her collaborator may be leaving his practice, and I'll be at it again, hoping that I can stay with the nurse practitioner who's cared for me for many years. I have been through some very difficult times, and I am certain that by seeing me and hearing me and paying attention, I am certain that my nurse practitioner has saved my life. Pennsylvania citizens will suffer unless we act together to eliminate the legal obstacles to full practice authority. Our fellow citizens deserve accessible and affordable health care and the choice of a provider that listens. The changes that are proposed are cost-effective, and they bring a new set of resources to a heavily burdened healthcare system at a time we really need them. For the sake of patients, both current and future, we need to support this legislation to grant independent practice authority for Pennsylvania's nurse practitioners. Thank you for this opportunity to speak, and thank you, Lorraine, for all of your help.
It is now my honor to introduce Dr. Jim Hammett, a collaborating physician who is now retiring, to speak on the power of full practice authority.
Well, thank you very much. I'm not sure I can as eloquently describe my current status as these folks have. There you go. Technically challenged. My wanted to tell you my story. I've been practicing family medicine for 48 years, and I had the good fortune to be a third-generation family physician. My grandpap was a family doctor in McKeesport and delivered just short of 30,000 babies in his 60 years. I also had the privilege of practicing alongside my dad for 25 years in the small town of Fairfield in Adams County. And we're just 7 miles away from Maryland. I'm certified by the American Medical Directors Association, which goes along with my nursing home work. And I'm also certified family physician with the osteopaths. I had planned on continue collaborating because it's one of the loves of my life. I've had very good relationships with nurse practitioners for, I guess I've helped serve over 20 different nurse practitioners over the years, including Lorraine and Jerry Budd, and it seems like in our world today, a nurse practitioner can lose her collaborator for who knows what reason, and I've had to step in and make sure that they were covered so that they can continue to practice. It's not on my notes, but I need you to know that I'm a little bit jealous of nurse practitioners because practicing in Fairfield, PA, my dad and I delivered babies, ran the ambulance, made lots of house calls, covered our own patients in nursing homes, even did intensive care medicine back in the 70s and 80s. And now the world has turned, and the folks that do all those fun things I always like to do are largely nurse practitioners. I've fully supported the introduction and in some ways exploitation of nurse practitioners in order to better take care of my patients. And I consider all these men and ladies to be my friend. They've allowed me to continue doing medicine the way I like to do it. I've jumped off of my syllabus here, and I think I'll probably stay off of it. Wanted to make a comment about collaborative agreements. They really aren't worth the paper they're printed on. It's a contract that's unnecessary. In my 20 years of collaborating, I've only had one experience that I had to step in and say no. And it was because I was working for a company that was so earnest in getting their employee ranks filled up, they brought somebody from way out of state, I think Alabama. And that person wasn't vetted properly, and in the process of collaborating, I did my usual research, and that person didn't need to be with our company. And that's only one in 20 years, and I've worked with way over 20 different individuals, and I find them to be tremendous assets to my practice of medicine. At the end of my career, WellSpan took over our office in Fairfield, Pennsylvania, so Dad and I gravitated over to doing long-term care. And if it wasn't for the nurse practitioners, long-term care patients would not have the high quality of care that they have now. I'm going to miss collaborating. I wish I could somehow continue, but I learned that even if I had one nurse practitioner I was collaborating with, I had to pay tail insurance, and it runs about $8,800 a year. And my nurse wife, who runs our checkbook, she says, Jim, she says no. So that's what happened to my collaborating. I'm now fully retired, and it's been one of the greatest experiences of my life, and I've been fortunate to have great experiences. So I fully respect and fully honor these people, and I'm going to miss them terribly. And even though I haven't met them all, I consider all of them my friends. So, thank you.
It is now my honor to introduce Representative Warner, our newest sponsor on House Bill 739.
Thank you. Good morning. I'm Representative Ryan Warner. I represent the 52nd District in Fayette County. And it is very much an honor to be here today among fellow advocates and some really outstanding healthcare providers. I just want to say that it is an honor to be a sponsor of this piece of legislation that previously I have co-sponsored in the past. But before I start, first of all, I want to say thank you. As we start Nurses Week, I want to say thank you to all the nurses that are here with us today. Thank you. Thank you to the nurses across this Commonwealth for the care and services that you provide. You know, we have many issues facing our healthcare system in this country and in this Commonwealth. Many of those issues are complex and require complex solutions. But before us today is a very simple solution that will benefit a great many Pennsylvanians. I think we can all agree that Pennsylvania is home to a lot of great nurses, doctors, specialists, and other medical professionals. But there simply aren't enough. And nowhere is that more evident in rural areas like the one I represent in Fayette County. So I ask, why on earth are we making this problem worse? Why are we holding on to archaic regulations that do nothing but prevent highly qualified nurse practitioners from providing the care they are fully capable of providing? And more importantly, care that our citizens so desperately need. This isn't a novel concept. It exists in 27 other states, and it's time to make Pennsylvania number 28. As I said, there are many complex challenges facing healthcare in our Commonwealth, and the solutions, by and large, are also complex. But this idea is one of the easiest and most effective things that we can do right now to make an immediate difference in access to care of our citizens. Again, thank you to all the nurses that are here today, and let's do the right thing and let's get this done. Thank you.
And now, we invite Representative Tariq Khan to come up and speak.
Thank you. All right. If you're proud to be a nurse practitioner, make some noise. Yeah, me too. So, my name is State Representative Tariq Khan, and I am proud to say that I am a nurse practitioner. I'm also a researcher, and I can tell you that I've looked at the research. In fact, many of us have. And there are a lot of arguments about why nurse practitioners shouldn't have full practice authority. Should we talk about some of them? All right. The first one is there's no data to show that NPs provide effective care, right? What do you think about that? All right. I've heard that we still need more time to figure this out. What do you think about that? I've heard that nurse practitioners, or they say nurses aren't qualified to provide the level of care that they're asking to. What do you think about that? Sometimes people, they don't understand the issue, and they think that we're talking about registered nurses. Raise your hand if you're a registered nurse, right? I'm a registered nurse also. But then after I did my nurse training as a registered nurse, I went back to school for 5 years, and I became a nurse practitioner. And I've had training to provide levels of care of being an effective nurse practitioner. I've also taken the boards. And raise your hand if you've taken the boards. as a nurse practitioner. Everyone has taken the boards and has been certified as being qualified to provide the level of care to what they're providing. And so the question is, what is the issue here? And as Dr. Hammett so eloquently said, it's the collaborative agreement piece of paper. Okay, let me ask you, nurse practitioner, raise your hand if you've ever needed a collaborative agreement to actually provide care to patients. Raise your hand if the collaborative agreement piece of paper has helped you provide better care to your patients. Raise your hand if a patient's life was ever saved because of the collaborative agreement piece of paper. Okay, there is 0 hands. For those watching on TV that might be cut off, there is 0 hands. So I am very proud, first of all of you who are out here taking time away. By the way, these are clinicians that have patients that are not getting care today with these clinicians because they have to advocate for an issue that should have been decided at least a decade ago. And I want to say that I'm very proud of my colleagues. Representative from the House side, Representative Gentz, Representative Ryan Warner. Again, and then on the Senate side, Senator Camara Bartolotta, who's really a good friend and also a great legislator, and also Senator Boscola and Senator Collette, who, as you know, is a nurse. Because this isn't a left issue, this isn't a right issue. This is a right versus wrong issue. And the collaborative agreement piece of paper is wrong. This is something, too, that has wide consensus. This is something that has, if you look at groups that are on the left, if you look at groups that are on the right, if you look at groups that are in the middle, they all agree that this makes sense because Pennsylvania is at a disadvantage because of these collaborative agreements. Pennsylvania is losing nurse practitioners who get trained here in Pennsylvania, but then leave to neighboring states where they can provide care without this expensive collaborative agreement piece of paper. So I believe that this is our year that we get this done. I truly do. We have 2 chambers that have amazing advocates that are pushing for this. We have the governor, Josh Shapiro, who is 100% supportive of this. And we have, most importantly, our patients who are asking for it, patients like David Hogan, who spoke eloquently earlier today, who say that, first of all, they agree that nurse practitioners should not have to have these collaborative agreement piece of paper. And they also say that they need it because they need the care. We have patients that have no primary care provider. These collaborative agreement pieces of paper make it more difficult for us to provide equitable care here in Pennsylvania. Let's take care of this issue once and for all. Let's get this bill done. Thank you very much.
And now, to close out our press conference, I'd like to introduce Janice Miller, the President-elect of the Pennsylvania Coalition of Nurse Practitioners.
Thank you. Thank you, everybody, for coming today. You are awesome. Awesome. We have heard today from well-known, well-respected, intelligent legislators who understand the problem and have a solution for it. So let's get this done. We have areas all over the state. It's not just a rural problem, it's a suburban problem, it's an urban problem. Ask anyone in Delaware County whose hospitals just closed if it's a problem. Ask anybody whose hospital in Conemaugh closed if they're having a problem. It is a problem across the state and people need access. So let's think about the 60-year-old patient who can't go to work because they have an ulcer on their leg and it's oozing, and we all know what that looks like. And they can't get an appointment for 3 weeks. So for that patient's sake, let's get this done. for the 14, 15, 13, 12-year-old girls in school who are having anxiety and depression because there's so much peer pressure and social media, and they're distraught and beside themselves, and they need help. And psychiatrists and primary care offices can't help them for a month. For that young patient's sake, let's get this done. And for that little peanut who is 4 years old and has strep throat and is having a fever and up all night, and so are mom and dad, for patience' sake, let's get this done. Thank you all for coming. Let's